Good afternoon and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside with my co-host, Dr. Loreena Ryder. We are licensed naturopathic physicians. We're here to help you navigate your journey to wellness, but we do it simply, without all the confusing medical terminology that everybody hates, and we're here to provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works. Every single episode, we start off by talking about what a naturopathic doctor is.
Hi, I'm Dr. Loreena Ryder, and I'm here to talk a little bit about that. A naturopathic doctor can provide primary care and specialized care. We look at the body as a whole. We determine the root cause of your symptoms. Then we treat the cause rather than just treating the symptoms. Your office visit looks a little different. You'll spend an entire hour with us at your initial appointment. We like to focus on prevention. We believe that's the best form of cure. We want you to get better. We want you to stay better and have a good quality of life moving forward.
And when we do spend that hour with you, we don't waste any time. We make sure we go through your entire history, all your previous labs. We go through all of that to make sure we know you, not just your numbers. And that's the best way we can decide together moving forward what's the best labs to test and then what's the best treatment protocol. When you go to the doctor, a lot of times you'll get your treatment right away because all they do is treat the symptoms and all they care about is the symptoms. A lot of times we don't even do a lot of treatment on the first visit, especially if you have chronic issues, because we need to run some quality lab testing that you've probably never had tested before, and you use those labs to determine the right protocol. We don't play guess games. We try to find the right treatment for you to get you feeling better.
Everything we do is comprehensive, from our intake to the questions we ask you and our testing as well.
So every single week we do a different topic. And there's a lot of piggyback each week because the body is a whole and we treat the body as a whole. But this week we're doing one that we haven't really talked anything about, and we're going to talk about the thyroid. So what is a thyroid?
So a thyroid is a small gland. It's located at the front of your neck, between your chin and your chest, right below the Adam's apple. Some people stick out, some people don't, and some people aren't even aware that we have a gland there. So your thyroid is there. It can be a little swollen in some people. You can actually feel it squishy. If you know where it's at, you can push it to one side, feel the squishiness, and that's where it's located.
Is there an Eve's apple?
That's a good question. Unaware.
I don't know. It's right below the Adam's apple.
It is, yeah.
Fair enough. So what does the thyroid do? It's a giant regulator through our bodies. It actually controls a lot. That little tiny gland controls a lot of different things in our body and can cause a lot of different symptoms that go throughout your whole body. One of the most common things people will actually get is weight gain or weight loss. It all depends on what the thyroid's doing. Is it too high or too low? But when it's imbalanced, or too high or too low, it causes a lot of different symptoms.
Yeah, so the thyroid is also, it governs our bowel movements as well. So if you're having issues with constipation or diarrhea, that's also dependent on whether the thyroid is pushing out too much hormone or not enough.
It's linked to hair issues. It's linked to hot and cold intolerances. And this is a big one for a lot of people when you're dealing with spousal stuff. Some spouses like it really hot. Other spouses like it really cold. Sometimes it's not just because they're crazy. Sometimes it's actually their thyroid.
Yeah, creates thermostat wars for sure. The thyroid also works alongside sex hormones. So whenever you hear people talk about hormones, they do all work as a family. So you have your sex hormones that govern your male and your female parts, but then you also have thyroid hormones which work alongside of those.
Brittle nails, dry skin, all these things can be associated with different problems with the thyroid. So we're going to go over a lot of the thyroid conditions today and the symptoms associated with them, and then also go over labs to test properly and treatments for it as well.
Yeah. Did you talk about hair loss? That's another big thing that people, whenever they come in with hair loss, thyroid is one of the first things that we check.
And hair loss can be caused by a lot of different hormones, but thyroid has a really tell. It's actually, you'll see it oftentimes on your eyebrows. If you start noticing some hair loss around the eyebrows, oftentimes that can be due to being low in thyroid.
Yeah, it tends to be the lateral third part of that eyebrow where it ends. And bulging eyes can be a big indicator that you have a thyroid issue going on.
And back on hair loss, though,
Oh,
most of the time we have hair loss, it's from hormones, but the other time it's usually when you're dealing with family,
oh, there it is.
stress.
Had to bring the family into it.
I have to.
Thermostat wars wasn't enough.
I was too nice with thermostat wars.
So some of the conditions that are associated with thyroid either being too high or too low, there's a list here and we'll go through them and just give a little bit of information on each one of these conditions. So you can actually have a thyroid goiter. It's generally a term for swelling. So you will notice this. It will be very noticeable at the neck, at the front of the neck, where it will swell up really big. And this used to be a problem back before, I think, 1924, before they iodized salt. So goiters can be harmless, or they can represent an iodine deficiency, which is exactly why they put iodine in salt, because most people will use salt in their daily diet. It can be also associated with Hashimoto's, which is a thyroid inflammation. It's an autoimmune disease.
Yeah, most of the time the goiters are harmless. But that being said, if you do see a goiter, you have to get that checked out to make sure that you don't have an issue with it. And in this country, we eat way too much salt. So this is not quite as common as it used to be because of all the salt that was dealing with it. Another condition is called thyroiditis. So itis, basically in medical terminology, is inflammation. So this is actually inflammation of the thyroid. Very commonly linked to a viral infection that can throw off your thyroid, or autoimmune conditions dealing with the thyroid. So autoimmune is when your body's attacking itself, or in this case, when the body's attacking the thyroid. These, because it's inflammation, oftentimes, like the goiters are harmless, these oftentimes are very painful. So if you have an inflamed thyroid gland, it can be very painful. But also times you could go years with this and never even know it, because you could also have no symptoms at all.
Yeah, absolutely. So anytime you have any inflammation within the body, I mean, it can be something, it can be a reason to start investigating a little bit further. And, you know, inflammation, we don't like to have inflammation typically in the body. So we want to do what we need to do to get rid of that.
So we do a segment called What Isn't Your Doctor Telling You? Now, again, this segment is not anti-doctor. This is just a segment to let you know that when you have your short visit with your primary care physician, they can't tell you everything. So it's kind of good information that when you go see your doctor or whoever you're seeing for your health care, you have a better idea of what's going on. So this week, I'm going to actually talk about something called TSH. TSH is a lab that stands for Thyroid Stimulating Hormone. This actually comes from the brain that tells the body whether or not you're making too much or not enough thyroid. Now, why this is such an important test is that when you go to your doctor, most conventional doctors, when they're checking your thyroid, only run the TSH. Now, again, that's only the brain telling the body if you have too much or not enough. It's actually missing a lot of other important factors that are necessary for thyroid function. So when you look at your labs at home that your doctor ordered for you, if all you see for thyroid is TSH, you actually have no idea whether or not your thyroid is actually working properly. And what's even scarier with that, neither does your doctor. If you don't run the other markers for thyroid, you don't know, because the TSH is not an end-all be-all number. You have no idea whether or not your thyroid is working properly. So if you go look at your labs when you get home or whatever, go look at those labs. And if you only see TSH for thyroid, you are missing the rest of your thyroid information, including some that are even more important than TSH.
Yeah, very true. And also very unfortunate. The minimum labs that you should have tested. These are minimum of what we do here is TSH, which Dr. Katz just talked about. You should also do a T4, which is your thyroxine. You can either do the free or the total, and also your free T3.
So when you're looking at the pathway, the TSH will make T4, and the T4 will then make T3. T3 is your active thyroid. That's what's actually doing the work in your body. So if your doctor didn't run T3 on your lab test, you have no idea if your thyroid is actually working properly.
And in my opinion, honestly, if we're going to choose one of those, I'm going to choose free T3 over TSH any day. But we should get, and there's many more. These are just the minimum testing that we do in our office.
And if you were diagnosed with hypo or hyperthyroid, it's also very important because of the amount of cases of people that have thyroid issues are autoimmune. And again, autoimmune is when your body is attacking itself. So when you're doing testing, if you've never been diagnosed and on your lab it's showing that you are either low or high in thyroid function, you need to also test something known as thyroglobulin or thyroid peroxidase antibodies. These antibody testing will actually measure whether or not your body's attacking the thyroid itself. If you don't test these with it and you've never been diagnosed prior to it, you have no idea if you have an autoimmune disease or not.
These are also very important for you to test. I think at least once a year, and especially if you have thyroid issues, but at least once a year, if you don't, these should be ran. Something other than like a low functioning thyroid, if you're suspecting that, you should do a thyroid ultrasound. There's no radiation with the ultrasound. It's very safe, but it will show up any abnormalities. And then if we need to, you can always follow up with a more, diagnostic CT scan or MRI.
And they also do radioactive iodine thyroid tests. The radioactive iodine basically, most of the iodine in your body gets absorbed through the thyroid. So all of that amount of iodine, so you can do a test called radioactive iodine scan where it actually shows how well the thyroid is functioning as the thyroid will absorb all of that iodine in the body.
Yeah, our organs have affinity for different nutrients and vitamins and items that we put into our body. The iodine, that goes straight to the thyroid. Thyroid loves iodine.
So just as a reminder, TSH, the brain part, the stimulating hormone, makes T4 and makes T3. If you do not get at least those three checked, you do not know if your thyroid is working properly. And I'm not kidding when I say probably 4 out of 5 labs I see from other practitioners only measure the TSH. And so if you're getting medications to treat your thyroid and they haven't looked at your T4 or T3 or any of the antibodies, you could be on a very improper dosage of your medication or not even need it at all.
You're missing a piece of the puzzle. It's like when you put a puzzle together and you have 1 or 2 pieces that aren't there, it's not the whole puzzle.
So back on the type of conditions out there, one of the conditions out there that is autoimmune, so again, those antibodies that we talked about have to be measured. And if those come back bad, then you can have autoimmune diseases. One of the autoimmune diseases is called Graves' disease. This is one that basically your thyroid is overstimulated, so it causes your thyroid to go too high. And the symptoms you would get with something with too high thyroid production is...
So you'll have like diarrhea, loss of weight, you'll be hot all the time and you just, you can't stand it. You might have some anxiety, some heart palpitations. These are just a few to name those.
And when you said weight loss, low thyroid is generally linked to people that have a trouble losing weight. With hyperthyroid, it's a lot of times people that have trouble gaining weight. Those are usually the people everybody's like, I hate you because you can't gain weight and you shouldn't complain about that because everybody else needs to lose weight.
You're like, give me that thyroid disease. I want that one.
That's right. But you don't want this one.
Right.
This is not, you don't want any disease, but this is not a good one because this one can also cause tachycardia, which is basically your heart is racing horribly. It can cause increased blood pressure. It can cause muscle wasting. That's why they look so thin, because they're actually losing muscle mass.
And this one, whenever I mentioned bulging eyes before, this is the hyperthyroidism or the Graves' disease, one of those telltale signs.
Tremors are seen with people with hyperthyroid. And one thing is actually the bulging eyes. We've all seen like the Ripley's Believe It or Not picture with that guy where his eyes are like coming out of his face. And it's like, wow, that's really freaky. That's why it's in Ripley's Believe It or Not. But there's actually people out there that have Graves' disease, hyperthyroid, where their eyes will start to literally look like they're popping out of their socket. And it can be a very dangerous disease.
Yeah, absolutely. Sometimes women will have amenorrhea, which means that you don't have a menstrual cycle. That can be a thyroid condition as well. It can be a sign of hyperthyroidism. You can also have finger clubbing, which is when the tips of your fingers will end up larger in shape and kind of shaped like an oval almost. That can also be a sign of heart disease, but also thyroidism.
Now, hyperthyroid can be very scary, but it is much more rare than hypothyroidism or the autoimmune that's linked to hypothyroidism, which is called Hashimoto's disease. Hashimoto's is a very common. In fact, anybody with hypothyroid should be tested for the antibodies to determine if it's autoimmune, because it is one of the most common autoimmune disease in the world.
Yeah, and unfortunately, patients will come in and I'll ask them, that they may have been tested for thyroidism and hypothyroidism and have symptoms and the labs that result in that. And I'll ask them if they have a family history of that. And they'll say, I don't know. I mean, it's possible because my mom has had these symptoms her whole life. So it is possible to go through your entire life and deal with these horrible symptoms that we're talking about and never have that diagnosis.
And the symptoms most frequently complained about when low thyroid is involved is the hair loss. And like I said, it can be on the top of the head, but oftentimes you'll see it in the eyebrows, like we said earlier. But fatigue, low thyroid function tends to be really tired. They get intolerance to cold versus the hyper was intolerance to heat. So anytime you think of the opposite, hyper to hypo, the symptoms generally go along with the opposite.
Yeah, the hypothyroidism tends to have a picture of constipation. And you talked about fatigue. Slow speech can be a part of that. A thick tongue. Most people don't think to look at their tongue. You stick out your tongue in the mirror, you'll see all sorts of things. And thick tongue is one of those.
Unknown causes of dry skin. We also talked about water. You have to drink water in the past, and water helps with skin as well. But unknown reason for dry skin, brittle nails, brittle hair, not just hair loss, but the hair feels thin and brittle.
And one of the things that you might not notice on yourself, but somebody else might notice on you, would be a dull, blank expression on your face. And obviously, you're not going to say, I seem to have a dull, blank expression. No, that's something that your family will notice before you'll notice.
And other things you can get tested when it's not hyper or hypo is some people get nodules around their thyroid. They get little bumps around the thyroid. These are generally, they're abnormal, but oftentimes are benign. They're very common. That doesn't mean if you feel a bump or your doctor feels a bump, you're going to want to get that tested or scanned just to make sure it's not something worse. But most of the time when there's a nodule on your thyroid, they're actually benign. Very few actually turn into cancer. Once in a while, you'll get one that actually will secrete hormone, but most of the time, they're actually no problems.
Yeah, so if you have a lump or a bump, best to just get it checked out, regardless of where it's at, if it's on your thyroid or not. Topic of the day, thyroid. So we're talking about eating iodine-containing foods. That's your tip of the week. Every week I like to give a little bit of information that you can do at home to help out with your health. So the thyroid needs iodine. We talked about that a little bit earlier. It needs iodine to function properly. And I think I did mention this way back in 1924. We had an issue with thyroid goiters, and people were getting the benign thyroid goiters, but that's something that needs to be fixed. So iodine was added to table salt. And that fixed the epidemic because we eat salt. Most of us have switched over to the pink Himalayan salt these days. And so we tend to be lacking in iodine again. So some of the iodine-rich foods that you should be eating, seafood is a big iodine-rich food.
Wild caught.
Should be wild caught for sure. So seaweed. So Costco has these little kelp seaweed snacks that I absolutely love, and they're really great. You can just eat them by themselves. You can have, them with a meal, put a little bit of rice in them, some meat.
They're really good. And the ones at Costco, I believe, are organic as well.
They are.
And we want to make sure if you're doing anything like seaweed for a snack, you want to make sure it's organic.
Absolutely. You can also eat some beef or chicken liver. That's not going to be your best source. Those should also be organic as well. But mainly it's the fish, the shellfish, and the seaweed.
So in the last segment, we talked about the most common causes of problems with thyroid, hyper or hypo, and the autoimmune diseases that go with it. So what about treatments out there? So the most common treatments people will get will be prescriptions. The most frequent one used is something called levothyroxines. Brand names are Thyroid and Levoxyl. Now, when we talked about thyroid, remember TSH is the brain stimulating hormone that makes T4, which is kind of the middle step, and then that makes T3, which is your active thyroid. These, the Synthroid or the levothyroxine, are only T4. So it's that middle step. So when you take the T4 stuff, it will, in theory, make T3. So if you have a problem with thyroid, that is the most common prescription given. And they came out with a new one called Tirosint. And Tirosint is another form of only T4. But a lot of people, when they were taking levothyroxine or the Synthroid or the Levoxyl, were actually reacting to the fillers they put in the drugs or the dyes that they were putting in the medications. So they came out with Tirosint, which is basically the T4 synthetic drug, but without the fillers, without the dyes. So it is a cleaner product that a lot of people have been switching to if they ever reacted to the T4 medication.
Yeah, so the in theory part is the trick there. So whenever your body really should convert T4 to T3 in theory, but doesn't always necessarily happen that way. And that conversion doesn't all of this does not happen in your thyroid. Some of it does, but it happens in the peripheral tissues. So your arms and your legs, the muscles there, that's where the conversion happens. So I tell a lot of people to make sure they're getting exercise. It's one more reason to get really great exercise is to keep your thyroid in good health.
And some people, even when you get T4, they don't convert it well. So they actually have a synthetic drug called Cytomel that actually produces, or it's just T3. So there are a lot of people who will be on two different thyroid medications. They'll be on a levothyroxine to make their T4, and then they'll be on Cytomel, or the generic version of that, to give them T3 as well. Now, there is one synthetic med out there called Thyrolar, and that one actually contains both T4 and T3. So the question we get a lot of times is, why wouldn't you just take the Thyrolar if it gives you the T4 and T3? When you test your lab, some people don't need T4 and T3, and other times is Thyrolar is more expensive than the other ones. So for cost purposes, levothyroxine is a really old, really cheap medication, and the generic Cytomel is pretty cheap too. So they're just cheaper a lot of times than getting the one that has both of them.
Yeah, which helps build our case on why you should test for all of the thyroid, T4, T3, and TSH, because it tells you what medication is going to work out best for you. Now, there are a little more natural type of thyroid medications on still the prescription side, and they are Armour Thyroid, Nature Thyroid. Basically, it contains T4 and T3. Now, this medication is a glandular medication from a pig. So they actually have a portion of the thyroid gland from that pig. But if you're vegan, you probably don't want to take this medication.
They're definitely not kosher.
Definitely not kosher.
No, they're made from a pig, but they do contain the T4 and the T3. And if you have an issue with either the processing or you don't want synthetic, you can also go to a compounding pharmacy and they can actually make a T4, T3 combo and get you your right dosage.
Yeah, that would be a good way to compromise on that one if you don't want to do the glandular. I think the compounded is a really great way to go.
Yeah, you don't want gluten, you don't want dyes, you don't want lactose. They put those in a lot of these medications. So if you don't want those in the medications, you can get a compounded form. It'll be the cleanest form you can get.
And we're talking about medications here because sometimes, ultimately, you do have to succumb to taking a medication. Now, there are natural ways to help your thyroid health. We'll talk about those as we go, but I just wanted to mention that really quick.
So those are the main treatments that you will see from a prescription standpoint for hypothyroid. For hyperthyroid, again, hyperthyroid is not nearly as common as hypothyroid, but there are treatments for hyperthyroid as well. And the most common ones people will get from a prescription side is called methimazole or propylthiouracil. Those will help lower the thyroid. These can fix the problem for some people, but also some people need to be on them continuously, which can be very scary because these are linked to serious liver damage, and you can't live without your liver.
Can't live without your liver.
So if you have high thyroid, oftentimes they won't give these medications because they have such side effects to them. Instead, what they like to do is kill your thyroid. It sounds scary, but it's easy in their mind is if you have something where your thyroid is way too high, uncontrolled, and you have problems, they'll actually kill your thyroid. They can use radioactive iodine, which can help the gland shrink and oftentimes can actually kill the thyroid. The reason why they consider that safer is because you can always be on the drug to increase your thyroid. They can always give you levothyroxine or Cytomel to feed your thyroid. So if you're low in thyroid, they're not so worried about that.
Yeah, it makes me sad, but yes, I get it.
And if there's cancer in the thyroid, surgically, they'll go in and remove it. Because again, if they can remove the thyroid, they can always give you thyroid as a prescription and keep that going.
Yeah. So let's talk just a little bit about naturopathic testing. So basically, we do the same as conventional. We make sure we get serum lab levels. So we do a blood draw. Now, we do more comprehensive testing than traditional medical doctors on the most part. We do. But we also can check iodine. We can check your metabolites of your DHEA, which would be the 7-keto DHEA. And one thing that we absolutely love to do is a food panel. We like to test your food sensitivities and your food allergies.
We do that because when you have an autoimmune disease, and again, most people that have low thyroid, or at least a big chunk of people that have low thyroid, oftentimes are autoimmune. So if you have an autoimmune condition, you need to know what foods your body's reacting to.
Yeah, absolutely. And for whatever reason, I'm just going to say this real quick right now, gluten has an affinity for the thyroid. I mean, it goes into your body and it goes directly to the thyroid and attacks it.
So we went over all of the conventional treatments and a little bit of the natural treatments out there. This segment, we're going to go over all of the other naturopathic treatments we can do to help balance your thyroid and get your life back.
At the end of last segment, I talked about gluten a little bit, so we're going to pick on your diet. Everybody loves talking about the diet, right?
We pick on your diet every single week, and we probably will every single week, but it's because your diet controls 80% of your inflammation in your body. So when you have a thyroid issue, thyroid inflammation, an underworking or overworking thyroid, you need to check your diet.
Yeah, inflammation is a big deal. And if you have a diet that's high in processed foods, sugary foods, that increases your risk of thyroid inflammation as well as thyroid autoimmune disease.
Inflammation has been linked to actually decrease. So remember, I've said it a couple times today, TSH is the brain that tells the body to make T4 and then makes T3, which is your active thyroid. When you have an inflammatory diet, lots of sugar, lots of processed foods, it actually shuts down the conversion of that T4 to make your active thyroid. So it will shut down your thyroid production.
We recommend a gluten-free diet, especially if you have thyroid disease, but basically I just recommend it for everyone. And I've said gluten a few times now on purpose because it really is that big of a deal. There's a huge connection between gluten
You
and
have to
thyroid
hear
disease.
everything 5 times before it kicks in.
Is it 5? I thought it was 3.
We're going to say it 3 more times. That'll be 6 then.
There you go.
But basically gluten-free, autoimmune diseases, gluten, they go hand in hand. It's very common. They've done studies on this, but people with autoimmune thyroid issues like Hashimoto's disease and having also autoimmune gluten, which is celiac disease, they've had tests on this where it's very common to see them together. So gluten is never good with autoimmune diseases, but there's a very high correlation with gluten-free or gluten problems linked to thyroid problems.
Yeah, absolutely. We talked about organic seaweed a little bit earlier, contains natural iodine, and that can help someone with low thyroid. Now, don't go overboard on the seaweed or the iodine. You really should go with that with recommendations from your healthcare provider.
Yeah, when you see the 10-pack at Costco, tastes great. You don't need to eat 10 of them in a day. Yes, I'm speaking to my wife and children. Every time we buy that, they're gone before I even get home.
My dog eats those.
They're good, but I never get any of them. They're gone before I get home.
Oh, yeah, maybe buy 2 packs. So let's talk a little bit about supplements. Vitamin B1 and B12 have shown to help improve the damage caused by hypothyroidism, and your thyroid really does get damaged when it comes to thyroid diseases and autoimmune disease such as the Hashimoto's and the Graves. So there is damage that occurs there. So we want to try to reverse that. So we'll talk about some vitamins that can help do that.
And one of the common symptoms of low thyroid is fatigue. And so B12 can absolutely help with the fatigue, because when you actually look at the pathway of where B12 is used in our body, one of the steps it's used is right before adrenaline. So when you do B12, it actually helps pick up the natural adrenaline in the body, but it's also needed for proper thyroid function.
Nice. Some food sources for B12 are beans, legumes, fish, seeds, and asparagus. Let's talk about some zinc and selenium. The thyroid loves zinc, loves selenium. They are trace minerals that have been shown to help balance T4 and then obviously helps the conversion to the active T3.
So you're going to hear a lot in these treatments and these supplements. Again, we never tell anybody that, yes, you have to go jump on these supplements right away. You need to understand that we are professionals. We give the correct dosages to our patients. And so we are not advocating you to go jump on all of these supplements. We're just giving you information. So when you speak to your doctor, you can get on the right dosage if needed.
Yeah, and autoimmune thyroid disease like Hashimoto's has been shown to reduce selenium in our bodies, and you may not know that you have an autoimmune thyroid disease. It may go undiagnosed for years. Some food sources to improve the zinc and selenium in your life would be fish like tuna, turkey, grass-fed beef, and some nuts, Brazil nuts specifically, and it really doesn't take that many to get your daily dose, just maybe 1 or 2 Brazil nuts a day.
Yeah, those are the really large ones. So that's equivalent to eating like 4 almonds per Brazilian nut.
Good point.
But zinc and selenium, when we talk about the TSH to make T4, to make T3, without zinc or selenium in good amounts in our body, you cannot do that conversion to the active T3. So without these 2 minerals, your thyroid can't work.
Yeah, and as naturopathic doctors, we like to talk about the body as a whole and everything working together in pieces. So the GI system, so your intestinal system, can also have an effect and link to hypothyroidism if there's a condition such as SIBO, which is small intestinal bacterial overgrowth, chronic diarrhea, and digestive disturbances such as motility, either being too fast or too slow. So probiotics are really great. They replace the good beneficial bacteria in the intestines and get that bad flora out of the body.
And we talked a little bit last segment about something called 7-keto-DHEA. It's actually a metabolite of DHEA, which DHEA helps make hormones like testosterone. But one of the things it also makes is 7-keto-DHEA, and that's something you can actually test. But when you're low in 7-keto-DHEA, you can gain weight, you can gain fat, and it actually slows down your thyroid gland and actually weakens your immune system. So when you actually take 7-keto-DHEA, if you need it, it actually does the opposite. It helps body mass lower, it helps build muscle, and it helps increase the activity of your thyroid gland.
And that is something that you can actually have tested to see if you are deficient in that.
They call that one an anti-aging thing. So for all the people that want to live longer, if your 7-keto-DHEA is low, it actually can cause you to age faster.
There you go. Iron is another mineral that you would want to balance out your thyroid. It's commonly seen in hypothyroid patients because iron is needed for thyroid hormone to be made. So whenever you're in the office, in our office, we check both iron and ferritin, which is your storage iron, to assess how these levels are being produced in your body.
And this deficiency is seen very commonly in people who have hypothyroid. But Taking iron, especially over the counter, actually causes a lot of hospital visits as well. So do not take iron without talking with your doctor first. Plus, if you take the wrong forms of iron, and that's most of the ones you're given by your doctor, they cause constipation and other GI issues.
Pleasant. Let's talk a little bit about ashwagandha. This is my absolute favorite herb. I love it. So a study published in 2018 showed that treatment with ashwagandha, also called withania, but I think ashwagandha is the more common name, improved thyroid function for subclinical hypothyroid patients. Now, those patients are ones who just kind of fly under the radar when it comes to labs. Subclinical means that, hey, your labs are still in range, but these patients, they don't feel good. They're like, yeah, my labs might say that, but I don't feel okay. So, and that's also where naturopathic physicians come in very handy, is we kind of micromanage those numbers.
And there are some herbs that help out there as well. One is called coleus, and that's an herb that's used in a lot of weight loss supplements. And one of the reasons why it helps with weight loss is it actually helps stimulate your thyroid. So if you're low in thyroid, you can actually lose some weight. And then there's also one called bladderwrack or fucus. It's actually the most common herb that is associated to treat low thyroid. It's actually a type of seaweed, so it contains the iodine that we've talked about multiple times now to help improve thyroid function.
Tyrosine is an amino acid. It's one of our foundational builders in our body. It makes T4 from TSH, and it can also help improve hypothyroid. And licorice root protects your thyroid gland from damage due to inflammation. It relaxes the stress hormone cortisol in our body and helps heal the damage in our digestive tract.
And for all you people who don't like exercise, if you have low thyroid, you need to exercise. There's been studies that show aerobic exercise, which is swimming, running, walking, bike riding, greatly affects the level of circulating thyroid hormones throughout your body. So it improves your thyroid function.
Yeah, and I had mentioned earlier how it helps improve the conversion from T4 to T3. So it's very important.
And yoga is a great way to do it. I'm not familiar with all the poses, but they tell me cobra pose is a good one.
Sounds good to me.
So thank you for joining us today on Your Health is Wealth. We're here to help you take charge of your own health, increase your quality of life, and support your natural healing processes. Please join us for another episode of Your Health is Wealth.
If you have questions or would like to find out more about the topics we discussed today, call the Naturopathic Physicians Group at 480-451-6161.